Okay, let's get started and talk about systemic arteries and answer the what questions. What are systemic arteries and why do we need them? And what are the primary systemic arteries and where do they arise and what do they supply? And what is a pulse? And what are the most common arteries used to measure a pulse? Hello, everyone. My name is Dr. Morton and I am the noted anatomist. All right, so first question is this: what are systemic arteries and why do we need them? Well, in this picture at the top, you see lungs. Purple capillaries, the pulmonary capillaries by the lungs. And you go like this. And you inhale, and oxygen comes into your airways and into your lungs, and they diffuse into the pulmonary capillaries. And then pulmonary veins are vessels that take this now oxygenated blood from the lungs back to the heart. Now, this oxygenated blood enters the left atrium, which then moves down into the left ventricle. And then during systole or systolic contraction, blood, this oxygenated blood from the left ventricle, is pumped out into systemic arteries. And these systemic arteries go to all systemic tissues in the body. And they go from the heart all the way out to these tissues. Well, these systemic arteries go from large arteries to medium-sized arteries to small arteries to arterials to systemic capillaries. And they're very, very tiny channels where red blood cells are coursing through in single file. And this blood is rich in oxygen, and these systemic capillaries are now surrounded by systemic tissues. So those little things that look like eggs and the ghosts from like Pac-Man had babies, those are actually supposed to be systemic cells somewhere all throughout the body, and then you put in these cells together to make a systemic tissue. So the blood coming in is rich in oxygen and nutrients, whereas the systemic tissues have already used the oxygen through metabolic processes and now have CO2 in high concentration with wastes. So oxygen moves from a high to a low concentration from capillaries to tissues, and CO2 moves from a high to low concentration from tissues to capillaries. So now as the blood is exiting the systemic capillaries, it's now showing systemic veins. And so the systemic veins are now taking these systemic veins are now taking the deoxygenated blood back to the heart. And so what is a systemic artery? Well, a systemic artery is a vessel that transports blood away from the heart to systemic tissues, and the blood is oxygenated. Now, in this picture, that shows two arteries, but one is red and one is blue. Arteries, by definition, is a vessel that transports blood away from the heart. A for away, artery for away. Now, a systemic artery transports oxygenated blood away from the heart, and pulmonary arteries transport deoxygenated blood away from the heart. So the key to is systemic arteries are going away from the heart, but it's red, so that's oxygenated. And then the pulmonary arteries are taking deoxygenated blood away from the heart, and that's why they're blue. Okay? Now, fetal circulation is the only other example where arteries are taking deoxygenated blood. I'm not going to hit those at this time, but just so you know, basically when you talk about arteries, they always take blood away from the heart. And when we talk about systemic arteries, it's usually we're talking about all the arteries that are taking oxygenated blood. And the exceptions, though, and they're big ones, are the pulmonary arteries, and then we start talking about fetal circulation, which isn't in this video. All right. So the next question is this: what are the primary systemic arteries in the body, and where do they arise, and what do they supply? Okay, so here we have a schematic on the right that we're going to be using that's going to show all of these different arteries. And these arteries are named for either the body region they're traversed or basically the organ they supply. And so here's an example of body region traverse. So it's in the axillary region, so they call it axillary artery. It's in the arm, so brachial artery. It's by the radius, so it's radial artery. Or the organ it's supplied. Hey, it goes to the kidneys, renal artery. It goes to the gonads, gonadal artery. And so we're going to cover all of these different arteries and talk about what they do. All right. We'll start with the ascending aorta that supplies coronary arteries. Okay, so that's where we're going to start. Here we have the ascending aorta. It courses from here, which is just above the aortic valve, up to the top of the aortic arch. Blood ascends, hence ascending aorta, and it transports oxygenated blood from the left ventricle to the entire body. Now, the first branch that comes off are these coronary arteries. It's the very first branch, and they're technically not systemic arteries. Coronary arteries really are part of the coronary circulation. So you have systemic circulation, pulmonary circulation, and coronary circulation. But I mention them here because coronary arteries deliver oxygenated blood and nutrients to tissue, in this case, myocardium of the heart. All right, next we're going to talk about the aortic arch and its associated branches. So there we have the aortic arch, and it gets its name because shing, it makes an arch. And coming off the aortic arch are three branches. Uno, dos, tres, right there. So we have three branches coming off the aortic arch. And so the first one we're going to talk about first, kind of funny how that works that way. It's the brachiocephalic trunk or artery, which is right there, and it comes from the aortic arch, and it only courses for a few inches up to the right side of the body. And so it's called the brachiocephalic artery because brachio means arm, and cephalic means head. And so when we take a look at this brachiocephalic trunk, this branch goes to the arm, and this branch goes to the head. Makes sense. It's called trunk because, like in a tree, where a tree gives rise to branches, well, this gives rise to two branches. One that goes to the arm, one that goes to the head. And artery, because that's what it is. It's an artery. All right, how about another name for the same artery? It's also known as the inanimate artery because inanimate means nameless. It doesn't have a name, which it does, but it doesn't. It does because we called it brachiocephalic artery, but it doesn't because it just says arm head artery. And so they called it inanimate, and some surgeons like to use it. I don't know if I'll ever use that term ever again, but I thought I'd mention it to you. All right, so there's our brachiocephalic trunk and artery. Now, the next, a branch off that is the right common carotid artery. It's called right because it's on the right side. Whenever you see a right or left with regards to an artery or a vein, know there's a left one. I mean, it always means that there's also one on the left. Okay? So whenever you see this word common with regards to vessels, it means it's going to bifurcate or fork. And so they're basically at the level of the voice box, the common carotid artery bifurcates to an internal and external carotid branch. And next is this word carotid, which is Greek for sleep or stupor, because the carotid artery goes to the brain, and if you block blood supply in the carotid artery so it cannot get to the brain, a person faints or they go to sleep. Okay. So there's our right common carotid artery, and it arises from the brachiocephalic trunk, and it supplies the right side of the head and brain, specifically the anterior part of the right hemisphere of the brain. All right, so the next thing, hold on one second. That was my son Max. Thought I'd share that with you. Now, the next thing we're going to talk about is what is a pulse? Well, a pulse is an abrupt expansion of an artery during systole. And a pulse helps us measure heart rate. And a presence or absence of a pulse can suggest disease like a thrombus or an embolus or something like that. So, and a pulse is best felt by compressing the artery against a bone. And so to talk about some of these pulses, let's first talk about the carotid pulse. And so it's an expansion of the right common carotid artery during systole, or even the left common carotid artery during systole. And you compress the common carotid arteries against the cervical vertebrae. And so here we have a picture, and you see just in dotted line through the skin is where the right common carotid artery would be. And if you palpate it there, there's the carotid pulse. All right. Now, let's go to the right subclavian artery. And the right subclavian artery is on the right side. And whenever you see the word right, you know that there's also going to be one on the left. And there it is. And so subclavian means below the clavicle. Submarine, below water. Subclavian, below the clavicle. As in right there. That's where part of the course is. And so this right subclavian artery supplies the right side of the brain, specifically through the vertebral artery in the back side of the right hemisphere. Branches go to the neck, branches go to the chest wall, the shoulder, and upper limb. Yes. Okay, so aortic arch, there's three branches. Now let's talk about the second branch, which is called the left common carotid artery. And it's called left because it's on the left side. If it's on the left side, you know there's got to be one on the right. It's common, in which whenever you see the word common, mean it bifurcates into internal and external carotid arteries. And then the word carotid is Greek for sleep or stupor. Again, you block it, no blood goes to the, or limit blood oxygen going to the brain, and they faint or they fall asleep. Ours is our left common carotid artery, and it supplies the left side of the head and left cerebral hemisphere of the brain, primarily the anterior part. All right, now the aortic arch, let's talk about the third branch that comes off of that. It's the left subclavian artery, and it's on the left side because there's one on the right, and subclavian because it's below the clavicle, like right there. And it supplies the left side of the brain, neck, chest wall, shoulder, and upper limb. Okay, so the subclavian arteries end at the first rib, which means then after the first rib, this vessel, which continues, it's the same artery, it just changes its name, is now called the axillary artery. And the axillary artery is this vessel that courses from the first rib to the bottom of the teres major muscle that is not shown in this picture. And the word axillary or axilla means armpit. And so the axillary artery supplies the axillary region and also parts of the thoracic wall and shoulder. The axillary artery courses from the teres major, ends at the teres major. Then after the teres major, this same vessel is now called the brachial artery, which courses from the teres major down to where it bifurcates in the cubital fossa of the just distal to the elbow. And so the word brachial means arm, and the arm is the region between the shoulder and the elbow, and that's where the artery is found. And so I'm going to now take another little tangent. I kind of like tangents. I'm kind of on a tangent right now, and my students know I kind of go on tangents. So this tangent is, what is blood pressure? Now, blood pressure is the pressure of circulating blood on the wall of a blood vessel. Now, blood pressure is expressed and measured in millimeters of mercury pressure, mmHg. The assumption is, whenever you talk about blood pressure, we're talking about systemic arterial blood pressure. And blood pressure is one of our key vital signs, just like respiratory rate, heart rate, oxygen saturation, and body temperature. And so here we have a cross-section of a systemic artery. And the blood within this artery, the pressure of blood on the wall of the arteries when the heart is at rest, is known as diastolic blood pressure. Now what happens, and that's usually somewhere around, in a healthy individual, around 80 millimeters of mercury pressure. Now what happens is this, is then the heart pumps and forces more volume of blood all into these arteries, systemic arteries, which then distributes this volume of blood throughout, and these vessels expand. And so now the pressure of blood on the wall of the arteries when the heart is contracting is called systemic blood pressure, because as we increase this volume and stretch the artery, there's a recoil that adds pressure, more pressure to this, and we call this systolic blood pressure. It's about 120 millimeters of mercury pressure. Now, why do I mention this? Well, the brachial artery is one of the key arteries that we use to measure blood pressure. And so here we have an arm, and you can see the brachial artery as it courses right by that humerus. And then as it, just before it bifurcates, it's right in this cubital fossa, and it's very superficial, so it's actually easy to palpate and to listen to. And so to then measure blood pressure, we use a blood pressure cuff. And the way we use it is the following. We have the cuff here that expands with air, and we have this thing that you can squeeze and then adjust, so you can increase the pressure in the cuff or decrease it. And then there's a stethoscope to listen to the brachial artery. And so what happens is this. We first increase the pressure in the cuff above systolic pressure. So we make it so that cuff is higher than 120 millimeters of mercury pressure, which then stops blood flow in the brachial artery. And if you stop it, there's no sounds. Then gradually decrease the cuff pressure, and you start listening for sounds in the brachial artery with the stethoscope. And the first sound of blood flow in the brachial artery is systolic blood pressure, which means that the pressure reading where blood starts flowing through that brachial artery is now the pressure of systolic blood pressure. And then you continue to gradually reduce the pressure in the cuff, and you're going to hear sounds and turbulence until finally the pressure at which all those sounds disappear is the diastolic blood pressure. So, and I put, this is completely generalized, for a healthy adult is about 120 over 80 millimeters of mercury pressure. 120 is systolic, 80 is diastolic. Okay, so that's blood pressure. Now the brachial pulse is where the brachial artery pushes right up against the humerus, and when you palpate that, it's another way of just measuring a heart rate. All right, now the radial artery courses along the radius bone. So there's the radial artery, and we see it coursing right around the radial bone radius. And just at the end is a good place to palpate the radial pulse, yet another place to feel one of the arterial pulses. And then the ulnar artery courses along the ulnar bone. So there's the ulnar artery, and it courses along the ulnar bone. And then finally, in the upper limb are the palmar arches. And so those palmar arches, we go zoom in a bit more, there's a superficial and a deep palmar arch. And I'm going to take another tangent. I know, quelle surprise. This term anastomosis, we're going to use that quite a bit in vessels. And what does anastomosis mean? Well, some organs and tissues receive blood from more than one arterial branch or more than one artery. And so here we have the rectum, okay? And in the rectum, there's three different vessels that supply it. We have a superior rectal artery and a middle rectal artery and an inferior rectal artery. And what happens then is where two blood vessels connect, we call an anastomosis. So you see these vessels that are now connecting them together, and so you see where those connecting together are called an anastomosis. And they provide an alternative pathway of blood, or collateral channels. And this is really good. And so, for example, let's say we go shing, and we block that middle rectal artery. And so no blood can flow from this artery. Well, these anastomotic channels can help supply that middle part of the rectum because of those anastomotic connections. Now back to the palmar arches. Well, there's our radial artery and there's our ulnar artery. And those two arteries come together and they make anastomotic connections, or an anastomoses. That's what we call the palmar arches. All right, so next there's our aortic arch, and there's our aorta. The whole thing from beginning to end. And it's the largest artery in the body, and all systemic arteries branch from the aorta, and it distributes oxygenated blood to all the tissues in the body except the lungs. That's the role. The pulmonary circulation brings blood from the heart to the lungs and back. Now the aortic valve is where the aorta starts, and the common iliac arteries is where the aorta ends. And the aorta's got a diameter of about 3.5 centimeters, somewhere in that ballpark. So if we now take a look at an American quarter, it's about 0.955 inches. I hate it when I do that. I just realized that I'd used metric system up there, and now I'm using the... Oh! All right. Anyways, being Canadian, I always usually use metric, and now I'm using that because it's American, and I'm not sure why I'm actually saying all this. But anywho, there we take a cross-section through the aorta, and we see how big the aorta is in cross-section, and we see that by cross-section, it's larger than a quarter. That is an enormous vessel. And that's why pressure can be in there up to like 120 millimeters of mercury pressure and higher. All right, so our thoracic aorta is what we're going to cover next. And so there we have the thoracic aorta, and it courses basically from where the aortic arch ends down to below the heart. And it's in the thoracic region. It's also called descending aorta because the blood is starting to move or descend, be traveled down. We're now going to look at a parasagittal section of the chest, and the entire aorta is shown in red, but there we've got the thoracic aorta there. Now watch what happens. Coming off the thoracic aorta, segmentally, we have these posterior intercostal arteries. And those arteries are segmentally supplying the thoracic and abdominal wall, the intercostal spaces, so intercostal muscles, abdominal wall muscles, and so forth. That's one of the functions of the thoracic aorta. Okay, and now the thoracic aorta, as it courses from there to there, once you get to the bottom of the heart, we hit the diaphragm, which is this muscular dome-shaped muscle. And then the thoracic aorta traverses that and now enters the abdominal cavity. So the name changes from thoracic aorta to abdominal cavity, which courses all the way down till it bifurcates at the common iliacs. And so we now enter the abdominal aorta and its associated branches. So there is the first ones we'll talk about, first branches, and that's the renal arteries. Renal is Latin for kidney. And so there we have our kidneys, and the renal arteries supply the kidneys, and about 20% of cardiac output goes into the renal arteries to supply the kidney. So it's quite a bit of blood goes to these very important homeostatic organs. Now the gonadal arteries are next. There's our gonadal arteries, and gonadal is Greek for child or offspring because the gonadal arteries supply the gonads. So in female, they're ovarian arteries because they supply the ovaries, and in the males, we call them testicular arteries because they supply the testes. And this is the primary sex organ because they make oocytes or sperm. The ovaries make oocytes and the testicles make sperm, and the gonadal arteries supply them in the house that Jack built. Okay. Now the GI arteries, where GI stands for gastrointestinal, the GI arteries are the ones that supply the GI tract. And so there we have one of these GI arteries called the celiac trunk, and it supplies the foregut. The foregut is basically stomach, part of the duodenum, and then the liver, gallbladder, pancreas, and spleen is what's supplied by the celiac trunk and its branches. Next is the superior mesenteric artery, and it supplies the midgut portion of the GI tract, which is distal duodenum, jejunum, ileum, and then ascending and transverse colon. And then our inferior mesenteric artery that supplies the hindgut, which is the rest of the transverse colon, descending colon, rectum, and part of the anus. And so there we have the GI tract arteries. All right, and so the abdominal aorta, basically right by the pelvis, bifurcates into the common iliac artery. Whenever you see this word common, you know it's going to bifurcate into an internal iliac and external iliac artery. And the term ilium refers to the iliac bone. And so the internal iliac artery is situated the word internal means situated on the inside, like that, the inside of the pelvis, and it gets its name because of the ilium. And the internal iliac artery supplies the pelvis and perineum. Now the external iliac artery gets its name, for the word external is situated on the outside because it's going to course outside the pelvis and go to the femur, and like that, or eventually get to the femur, and ilium because it also pertains to the ilium. Like that. Okay, so external iliac artery supplies the lower limb primarily because that's what it's going to go. It also sends branches to the abdominal wall and pelvis. Okay, so here we've got external iliac artery, and I'm going to draw the inguinal ligament like this. Shing! It's an aponeurotic extension of the external oblique that goes from the anterior superior iliac spine to the pubis. And after the external iliac artery courses deep to the inguinal ligament, shing! Like this. There's our inguinal ligament, and there's the external iliac artery, and when it goes underneath the inguinal ligament, it becomes the femoral artery like that. So, external iliac artery, femoral artery. External iliac artery, femoral artery. Okay? Now the femoral artery gets its name because it courses along the femur bone. And so there's our femur, and then the femoral artery courses along that the femur bone. And so here we have another picture of just showing it. It's right there just below the inguinal ligament in the groin area, and that femoral artery courses from anterior to medial. Now, there we can see the femoral artery dotted like through the skin and palpating just there in the middle part of the groin region, in the midway between the inguinal ligament and just below it is where you can palpate the femoral pulse, whereas one of the other key clinical pulses to know where it's located. In this picture, we've taken all the quad muscles away, and I'm outlining a muscle called the adductor magnus muscle. And so the detail of the adductor magnus is not so important, but this opening here, called the adductor hiatus, is important because what happens is that femoral artery courses down and then goes through the adductor hiatus to go behind the knee. So proximal to the adductor hiatus, we call it the femoral artery. Distal to the adductor hiatus, it now changes its name to popliteal artery. And so there is the popliteal artery, like that. behind the knee. So if we now take a look, the word popliteal means behind the knee. So the muscle behind the knee is called the popliteus muscle. The artery and vein, popliteal artery and vein. And so to feel, there we can see dotted is the popliteal artery, and to feel that is the popliteal pulse. All right, so a branch off the popliteal artery is the anterior tibial artery, and it supplies the leg and foot. And so the anterior tibial artery courses anteriorly to the tibia. So there's the tibia bone, and then this artery courses anterior to the bone. And then distally, on the dorsum or the top of the foot, the part of the foot that touches your shoelaces, between your great toe and the second toe is another artery that's called the dorsal pedis artery. That if we were to show a dotted line of where it's located, again, between your great and second toe, is where you feel the dorsal pedal pulse. This is another very important clinical pulse to be able to palpate. If you can feel a dorsal pedal pulse, it usually means there's a healthy arterial supply to the lower limb. This is one that's important, especially with people who are diabetic, to make sure that there is a healthy dorsal pedal pulse, or that all the tissues, especially distally in the bottom of the leg and the foot, are getting adequate blood supply. Now, the posterior tibial artery is the other branch off the popliteal artery, and it courses posteriorly to the tibia, and it supplies the leg and the foot. So, let's now talk about systemic arteries in a nutshell. Okay, so systemic arteries in a nutshell. Well, the ascending aorta gives rise to branches, the coronary arteries that supply the heart. The aortic arch has 3 branches that supply the head, neck, and the upper limbs. The thoracic aorta has branches that segmentally provide blood supply to the thoracic and abdominal walls, and the abdominal aorta and its associated branches supply the abdominal pelvic organs, abdomen, pelvis, perineum, and the lower limbs. Key pulses are the carotid pulse, brachial pulse, radial pulse, femoral pulse, popliteal pulse, and dorsal pedal pulse. And that, my friends, is systemic arteries in a nutshell. Doodle-doo-doo-doo.